is leading the region with over 2,862 cases, 85 fatalities, and 849 recoveries. This infectious rate represents over 3,500% increase from the 172 cases reported on 30th March. I think that is whooping increase, but that we can see all over the world, replicated in almost every region. The region has aligned itself with the global measures recommended by the World Health Organization for preventing and mitigating the spread of the disease. Countries in the region have adopted a wide range of measures, including one mandatory 14-day quarantine for travelers to the region. Another restriction, which is number 2, is a restricted cross-border movement of people while allowing movement of goods. And then the third measure is curfew and restricted circulation and social gathering to enhance the rule, on social distancing. As a result of those 3 measures, the World Bank and other expert organizations project economic declines as COVID-19 threatens not just the economy, but also peace and security. The focus of this seminar, therefore, is the implications on transnational organized crime. Do COVID-19 measures constitute ultimate deterrence against organized crime? That's a very important question for us to look at this afternoon. Many of you would have read various studies, analyses, and commentaries online indicating that COVID-19 or the measures adopted by the governments have provided both opportunities and challenges for transnational organized crime. This seminar seeks to evaluate the situation in East Africa. The presentations you're about to hear go a step further in showing just how this is happening in some criminal economies, including drugs, illegal migration, and fake pharmaceuticals. We will also hear how the measures have affected violent extremism and terrorist groups in the region. Today's webinar has been made possible with funding from the European Union, which fully funds the ENACT project. This project is implemented by the Institute for Security Studies and the Interpol. In association with the Global Initiative Against Transnational Organized Crime, the project aims to enhance Africa's response to transnational organized crime. This online seminar is similar to a face-to-face event, so usual rules will apply. But it is important to note from the start that considering this is a recommended open event, Chatham House rules do not apply. I also wanted to share a few ground rules that will help the smooth flow of the seminar. We have been receiving comments and questions from participants upon registration, and these are welcome. I will read these after we have heard from the speakers. Each speaker will share views for 10 to 12 minutes each, after which we will entertain interventions, comments, and questions from the floor. It's of critical importance that you keep your cameras off and audios muted during the presentations and comments. Nevertheless, there are a few ways in which you can indicate to me as the chair that you would like to make a contribution. First, if you click on the participant's logo in the bar at the bottom of your screen, you will give an option on your right to raise your hand. That's, you will be given an option to raise your hand. And then Once I indicate who has the floor, the ISS administrator will activate your mic and request your camera to be turned on. Please be patient as the activation does take a second or two. Second, if you click on the chat logo in the bar below it, it will allow you to make written comments to the entire group or to specific participants privately. Feel free to write your comments there at any time, which I will highlight to the speakers in due course. I will be keeping a speakers list and indicate who has the floor next. If you have any technical queries, please message ISS admin user directly using the chat function. We expect the seminar to last for around 1.5 hours. So please, in respect to the speakers and other participants, make your comments and questions as concise as possible. That said, it is my pleasure to welcome you all to the seminar, to express a special welcome to our panelists. I am sure we will have a great discussion in the next 1.5 hours. We will begin with opening remarks from the EU, and we would like to welcome the EU representative. It is an honor and consider it a privilege for you to join us for today's webinar. You have the floor, sir.
All right. Good afternoon, everybody. Am I on?
Yes, you are.
Okay. So good afternoon, everybody, and welcome to this webinar on the impact of COVID-19 on transnational organized crime in East Africa. My name is Vincent de Boer. I'm the head of macroeconomics and governance at the EU delegation to Kenya, and I'll be making a few remarks specifically, mostly from the Kenyan perspective. When COVID-19 first reached the shores of East Africa in about March of this year, we first started by adapting some of our programs on mobilizing additional money to help Kenya deal with the crisis, specifically on the health side, but also dealing with the socioeconomic impact. And as a result of that, we've mobilized about 60 million euros that we are disbursing in the coming weeks and months in different areas. That ranges from direct budgetary support to the government of Kenya, to a number of NGOs, AMREF, Oxfam, Red Cross, to boost the community health response. We're giving money to Trademark East Africa to promote safe trade, and that's specifically looking at the border post between Kenya and Uganda to keep trade flowing there. And also we're discussing with the European Investment Bank to provide liquidity support to SMEs. Separately, we reviewed our existing programs to see how they need to be adapted to the new operating environment, and that's where we come to the topic of today, to see how some of the existing projects can actually help us to better understand the new operating environment and the implications this may have for our work moving forward. Personally, I'm coming to the end of about 4 years in Kenya, but I still very distinctly remember the first time I interacted with the ENACT project, which was in the context of a presentation of a study on the impact and implications of the heroin trade on the Eastern African shorelines. And this study was co-authored by Simona Haysom, who will be one of the keynote speakers this afternoon. Also, other outputs of the ENACT project have not gone unnoticed by senior officials of the European Union, both in Brussels and in the delegations. And this in particular the case for the Organized Crime Index, which was launched in 2019. The Organized Crime Index ranks countries according to their vulnerability to organized crime, as well as countries' capacity and political will to respond to and tackle the phenomenon. In April this year, ENACT issued the paper Crime and Contagion, the impact of a pandemic on organized crime. This document made us in the delegation in Kenya very much aware of the opportunities which the current COVID-19 crisis is creating for criminals. For instance, and Dio mentioned that there's a growing criminal market in COVID-19 related falsified products such as substandard masks and serological tests. Now that paper triggered discussions that ultimately gave rise to the webinar of this afternoon. And I thank the colleagues of the ISS as well as the colleagues at Interpol for having made this possible. Needless to say that the issue of transnational organized crime is a topic which is of increasing relevance for the European Commission. Growing levels of crime and related instability have the potential to undermine the gains of socio-economic development in our partner countries across Africa. And I therefore look forward to hearing from the different speakers today to help us, or to help all of us develop a better understanding, specifically how transnational organized crime is adapted to the COVID-19 context and what that means for the work we are implementing in the region. So in closing, let me welcome you again, and I hand back to the chair, Dio Gumba. Thank you.
Thank you very much, Mr. Vincent Dubois, for your warm remarks, which further emphasizes the importance of the topic and the role of the European Union, which we cannot thank enough for funding this webinar. As I said earlier, we have 4 great speakers from the consortium of organizations that implement ENACT. We also want to make this seminar as interactive as possible. I will therefore kindly request each speaker to take 10 to 12 minutes to give us the key points with regards to how COVID-19 has impacted the criminal economy of their focus. Once we have heard from the 4 speakers, we will open the floor for discussion. I would therefore request that you jot down your questions as they speak and send them through, or wait and raise them during the discussion. They will respond to your comments and questions in the subsequent rounds of their intervention. So the first speaker, as you heard, is Simone Haysom. And Simone Haysom is a senior analyst at the Global Initiative Against Transnational Organized Crime. Simone, can you tell us from your studies the key impacts of COVID-19 on the drug market in East Africa? We know in the region, the drug market is huge: cocaine, heroin, cats, cannabis, and synthetic drugs. Please explain to us how these markets have been affected. Have you witnessed the rise and fall in certain drugs? Simone, you have the floor.
Thank you very much, Deo. Thank you very much for the introduction. And thank you very much to ENACT for organizing a discussion on this important subject. As Deo mentioned, I'm a senior analyst with the Global Initiative Against Transnational Organized Crime. And my beat is broadly the Southern and East Africa region. In particular, I've done a lot of work investigating and analyzing the political economy of the heroin trade, including in the report that was so kindly mentioned by the EU representative, and in mapping routes across the region and trying to understand local markets. Most recently, also under ENACT, I worked with a team of researchers to produce From Maskani to Meya, the political economy of heroin markets in East and Southern Africa, which is a report you can find on the ENACT website. This builds on the previous Heroin Coast report, which looked at transit trafficking of large volumes of heroin, and at that transit route's deep impact on corruption and governance. From Maskani to Meya really looks at local markets, looking at 18 cities and towns in the region and analyzing how their local drug markets, particularly heroin markets, and criminal networks that service them have developed. And I think it's important for the discussion we're having today to understand what those reports flesh out is how internationally and regionally connected the drug markets are across this region. And also how adaptive and long-standing the criminal networks that link consumers to drug supply My expertise, as I mentioned, is more with heroin than with other drugs, but today I'm going to talk a bit more broadly. I'm mentioning some developments we notice around cocaine and meth in particular. I might not be able to handle detailed questions on those markets, but hopefully I can sketch out a high-level picture that may still be useful. And I think it's useful to think about what these impacts might be by thinking about the supply chain of drugs in the region. And to bear in mind that there are both big retail markets and also transit trafficker markets going through the East Africa region and through the Southern African region. We broadly identify three so-called hard drugs as being the most significant for both Southern and East Africa, and two have significant consumer markets. One of those is heroin and the other one is meth. The market for meth is primarily in South Africa, though we are monitoring any developments around meth markets developing in other countries in the region. And it's also important to note that East Africa and increasingly Southern Africa also host a transit route for cocaine, a small one, but one of perhaps growing importance with some measure of local use. And all these drugs and their precursors are obviously imported, and their import routes implicate different types of transport infrastructure. And different aspects of the transport system have been impacted in different ways by lockdowns and other COVID-related developments. For the region, however, import by container cargo, by bulk carrier, and by dhow looms very large for drugs arriving in East Africa and Southern Africa. And the illicit trades that are transported through these means have been far less affected than media reporting would suggest. And the contraband trade is obviously coasting off that illicit trade. So we don't see the major disruptions that one might well expect. While there's also trafficking by plane, and airlines and air routes have been severely disrupted by COVID measures, the drug muling that's prevalent in East Africa tends to be taking drugs out of the continent. We've previously profiled in a risk bulletin that the GI Observatory puts out the role of various airports in East Africa, which have at different times played more significant roles in that drug muling trade. But this has always been for getting drugs to primarily Asia, to a lesser extent, the Middle East or Europe. And if we go further back than that and look at regions of supply where these drugs would originally be coming from, we also don't find major disruption. So global opium poppy harvests appear to be relatively unaffected. Sources in Afghanistan confirm that the current crop of opium poppy has been largely unaffected, and also that eradication efforts have been fairly insignificant in the wake of coronavirus. As a result, the potential amount of poppy cultivation lost eradication efforts most likely be negligible. And this year's poppy harvest may come closer again to recent record levels. It's too soon to say whether this will be the case, but it seems likely that the availability of Afghan-based opium, which is what results in the heroin supply to East Africa, is viable and largely uninterrupted. Likewise, we don't see any significant restrictions on cocaine cultivation or production. There's a slightly more complex calculation when it comes to chemical precursor production and the supply chain integrity there. And this is very relevant for meth manufacturing. But with certain qualifications, these also do not appear to be severely disruptive. It takes us slightly outside of the region, but perhaps it's interesting in the context of talking about the disruptions we can and can't expect. The the drug market where we see perhaps the biggest or clearest disruption due to COVID is in South Africa, where traditionally Cape gangs have exchanged a seafood called abalone for meth precursors with Asian networks who import them. And abalone, in fact, has crashed in price for reasons which aren't entirely clear. But we're yet to see the impact of that in South African meth markets. In fact, our networks across the region have confirmed a reasonably constant supply of heroin, methamphetamine, and cocaine throughout the lockdown period. Dealers in South Africa indicate that there's no shortage in local supply, just a slower demand. And it's perhaps here where there is the greatest amount of movement in terms of different effects of lockdown. Because where lockdowns have been very strict, which isn't uniform across the region, Tanzania in particular stands out as a country which has not implemented a strict lockdown. But where lockdowns are strict, consumers are no longer able to freely access local dealers in some cases. And perhaps even more importantly, the economic effects of lockdown affect drug users as well. And in many ways, more severely. There are small numbers of drug users across the region who may be able to stockpile their drug of choice during the crisis. But dependent users, of which highly dependency-forming drugs like heroin, there are a number across the region, will continue to try and access heroin regularly. And will be very vulnerable to predatory pricing behavior by local drug distributors who can essentially exploit the pandemic crisis. We've seen interesting movement in that regard. So some increase in pricing initially as an income maximization move by dealers, but then a reduction in demand as lockdown measures really cut into people's incomes and ability to raise money to buy drugs, as well as sort of moves to detain homeless people. And as a result of reduced demand, in some places, prices appear to have fallen again. So it's obviously a rather dynamic situation. We see many attempts by drug user networks to adapt to the situation and in the ways that they are able to reach consumers, including exploiting loopholes in lockdown requirements, which give them a pretext for being on the street or being able to leave their homes. I think it's also important to underline that when considering local markets, drug users are often very marginalized populations already, and they face a range of consequences that deserve specific interventions. Across the region, they already have huge difficulty accessing health services, to the extent that it does become harder for people to afford drugs or to access drugs that may trigger a desire to reduce dependency. But we know that there are, in general, very few services that enable people to do that safely. East Africa perhaps has the best track record in this regard, with methadone assisted therapies in various locations, but again, the population of dependent heroin users is much larger than the services that are available. Something else that we would expect to see and are starting to receive some reports of adulteration of drugs, typically by users to make them go further as their resources are constrained. And this can have health implications, as well as users switching to different methods of use. So for heroin, these kinds of restrictions and difficulty around access can trigger people to switch to injecting, which initially often seems like a cost-saving measure. I think it's also in the context of the massive growth in state power and state surveillance, state presence implementing lockdowns in certain communities, and at a time when across the world, due to events that are happening in the US, we're thinking a lot about police abuse and racism, to really reflect deeply on how the region's approaches to drug policy could reflect and deepen problems around very problematic relationships between the police and marginalized communities like drug users, including in South Africa, where this has a racialized dimension. Other than that, we also identify the potential for the crisis to trigger the development of new routes globally, as drug organizations adapt to places where there are more severe or noticeable disruptions to their usual routes, and where globally law enforcement operational capacities are likely to decrease, and borders will not be as hard or as closed as one might expect. We, in this regard, already notice in regard to cocaine, the increased use of Mozambique and South Africa as a transit route, and also some surprisingly large meth seizures that have been made off the coast of Mozambique, indicating networks bringing in readily manufactured methamphetamine, whereas local networks in Southern Africa were manufacturing methamphetamine in country, which also suggested perhaps new routes trying to be established, or new networks trying to get access to a market that's growing. In our work in South Africa, while meth use was for a long time very much associated with the Cape Town market, in conversations with health workers, people who work with drug users, we don't have hard data on this, but people notice a very noticeable uptick in the amount of methamphetamine use across the country. And South Africa is already connected, the drug market is already connected to the rest of the region through criminal networks that have their origins in regional migration, including to East Africa. And this may be creating a prospect of a lucrative market that's growing and is attractive to enter. Speaking about the vulnerabilities of the East African region in general to this, states with weak, vulnerable, fragile, or significantly inequitable economies are more susceptible to drug organization infiltration of their governance systems and their institutional structures. And I think that's something to think about in regard to the region, because it's certainly been the case that the drug routes that we have studied, which have developed over the last 20 years, have already taken advantages of those weaknesses. Lastly, I think there's a question around the ways in which very localized and criminal networks which are very embedded in communities will react to the lockdown and to some of these changes. And we already notice in some places a conscious effort by gangs to provide forms of social relief as a way of generating influence and corrupting local communities. And I think that's going to be very important to keep track of as we go forward. I look forward to taking people's questions about any of these themes. I think there's a lot to explore in drug markets across the region. The Southern East Africa region hosts large markets, large local retail markets, and increasingly significant transit markets, with implications both for local communities and for governance structures. Thank you.
Thank you, Simone. Absolutely phenomenal, because she has talked about the drug markets in the region and the types of drug markets, and that's the three, especially heroin, meth, and cocaine. You've heard how these markets, the nature of these markets, and the harm that they cause, most importantly. Also, it was interesting to hear how COVID-19 has led to, has triggered new routes, and also, the increased use of Mozambique and South Africa as transit routes. That's very, very interesting. And also the fact that gangs are providing relief as a way of maintaining control over territories. So, ladies and gentlemen, you have heard that. Whatever questions you have, I can see the questions are coming in fast and furious. Please keep them coming in. We are also going to give you a chance to ask your questions if you wish to take the floor. So I will then move to the next speaker. And our second speaker is Lucia Bard, senior analyst at Global Initiative Against Transnational Organized Crime, the same organization that Simone works in. Lucia, what do the preliminary findings of an upcoming ENACT research paper say about how COVID-19 measures are reducing migration and human smuggling in East Africa? Have you observed the opening of new routes and closure of others, especially given that air travel and road transport across borders have been significantly reduced? So, Lucia, you have the floor. I'm sure you will have much more to say than to answer those two questions.
Thank you, Deo. Indeed, and much more to say than brief presentation, but I will do my best to capture the key points. So, as you mentioned, Deo, state responses to COVID have really focused on closing down borders. And we've seen the increasing securitization and militarization of many. And in addition, we've seen movement restrictions imposed domestically within countries. Now, these pose both a barrier to human smuggling operations and also an opportunity. The latter because in many areas where independent and regular movement was once possible, it is now not possible, and movement is increasingly irregular and requires the support of smugglers. Now, these measures have, as explored by Simone, caused some disruption to the movement of goods, but the focus of these restrictions has been on stopping movement of people. And consequently, we're seeing really quite serious impacts on the human smuggling industry. However, we can differentiate these, as Deo started to touch on, between sea routes, which are arguably the least affected, land routes, which have been very heavily affected, and air travel routes, which have been the most affected of all and almost entirely disrupted. It's too early to definitively tell how COVID will impact human smuggling industry in the region in the long term. However, we have been collating evidence regarding its preliminary impacts, and we can start to build some medium-term predictions. I will outline some of the ways in which the pandemic is shaping the human smuggling industry in Southern and Eastern Africa. For those of you that wish to gain a fuller insight, we have published a policy brief recently on the topic called The Impact of Pandemic on Human Smuggling, and we will be publishing an upcoming report for the ENACT program called Human Smuggling, the Creation of a New Criminal Economy, which explores the impacts of the criminalization of the human smuggling industry across Africa, and then explores how COVID may have accelerated or diminished some of the trends explored. So, to look at how the human smuggling industry has been changing. Firstly, we've seen a shift in some of the routes that are used. To speak first of air routes, we've seen the almost complete closure of air travel, which means that human smuggling by air has been almost entirely disrupted. It's important to bear in mind that this is typically the safer, more expensive, first-class version of travel by human smuggling networks. And this is likely to be displacing some movement onto land and sea routes, either now or in the near future. Further, intercontinental travel, for which air travel has been absolutely key, has been heavily disrupted. More broadly, as borders have been increasingly securitized and many borders have closed down, we're seeing more circuitous routes which evade these border closures and heightened vigilance. Now, this leads me to think about the modus operandi of human smuggling networks in the region. So, for those that are continuing to operate during the pandemic, they need to not only avoid the traditional targets, so law enforcement, border officials, but also bypass additional travel restrictions domestically and evade local communities or armed groups that have chosen to resist human smuggling operations and even ban them within their own territories. Consequently, smugglers have had to move further underground to evade detection. And they've been repeatedly tracked, taking riskier routes, which pose more danger not only to the human smugglers themselves, but also to the migrants that they are transporting. And this is not only due to routes, but the type of transport that these smugglers are using to hide their migrants. Now, one example that we had in Mozambique, a tragedy that occurred in late March, really exemplifies what these changing modus operandi can really mean for migrant protection risks. So on the 20th of March, the Mozambican government imposed strict border controls to prevent the unnecessary movement of people in the same way that many countries across the world did to prevent the spread of the pandemic. 4 days later, smugglers were trying to move 78 Ethiopian migrants and refugees into Mozambique. We believe that these were moving across the southern route. And when Mozambican immigration inspectors opened the lorry, having been alerted by noises, they found the bodies of 64 of the migrants that had passed away, along with 14 survivors. Now, we believe that the tightened border controls are likely to drive more smuggling networks to take similar approaches of disguising people as goods and using these sealed container methods, which we have seen across Europe and across Africa often entail significant migrant fatalities. In fact, Europol, in a recent report, has noted that the rise of the use of containers to move migrants, it was already a key trend that we were seeing as smugglers evaded heightened border controls, but that this has been accelerated by COVID and states' counter-COVID measures. In terms of pricing, we have started to track some changes in pricing since the pandemic, largely increases, which tracks the higher risk of continuing to operate for human smugglers, but also the higher cost of bribes. And here it's key to note that the pandemic is changing political calculations. So stopping the irregular movement of people has become even more of a priority for many states. And the pressure from the higher echelons of state to stop irregular human movement is much higher. This means that the risks of sanction for corruption and letting smugglers go through borders or through domestic travel controls is much, much higher. Further, it's not just sanctions from within the state, but also there is significant community fear as to the contagion. So the cost of going against these pressures is much higher than it was previously, driving up bribes, which obviously the smugglers then pass on the price to the migrants, and increasing prices for smuggling services. We've seen some human smugglers diversify into other commodities because smuggling of people has become simply too risky. We've seen diversification, for example, into smuggling of fuel or gemstones. We've also increasingly seen smugglers abandoning migrants along the journey because it simply gets too difficult and too risky. We have repeatedly seen this reported on the southern route, for which South Africa is typically the primary destination. We've seen reports of large numbers of Malawians and Ethiopians stranded in Zimbabwe, abandoned by their smugglers because it was simply too difficult to complete the journey into South Africa. In May, the International Organization for Migration reported that over 2,000 migrants were stranded in Djibouti after being abandoned by smugglers while trying to move across the eastern route. So these migrants were hoping to be smuggled across the Red Sea to Yemen and then reach the Gulf states, mainly in search of work. However, the smuggling networks, given the increased challenges posed by states' restrictions on borders and domestically, simply abandon them in the face of this higher risk. It's key to note the extremely high vulnerability of migrants at these bottlenecks. Particularly in the COVID context, this constitutes a significant public health risk among a population that is particularly underserved by the health infrastructure. Further, we're seeing the use of human smugglers to get home. As in previous pandemics, such as with Ebola, we have seen that many people that were living outside of their country of where they are a national, try to get home as they start to understand the risks of COVID. But the closures of borders mean that many are forced to move irregularly and that many are forced to use the services of smugglers to get home at all. Zimbabwe, which is a transit country for migrants in the region moving towards South Africa, has been overwhelmed by the number of its own nationals returning from neighbouring countries, as well as foreign nationals trying to move through the country on their way home. Similarly, thousands of Mozambicans have moved home from South Africa, with a significant proportion of this surge being before lockdown and with the slightly looser travel restrictions, that this is ongoing. And there are reports of hundreds of migrants stuck in South Africa trying to get home, for example, in Messina, which is the last town in South Africa before the frontier with Zimbabwe. This has been reported. Now, it's key to note that under the UN smuggling protocol, human smuggling offences relate only to the facilitation of the unlawful entry into a country, not the exit from a country. This respects the position under international law, which enshrines the right of any person to leave any country, including their own. However, a number of countries in Africa, including Ethiopia and Kenya, have changed the definition of the human smuggling offence to include the facilitation of the exit of a country. This means that this facilitation by smugglers of these migrants trying to return home is also liable for interdiction and prosecution. Finally, we may be seeing a shift in the perception of human smuggling activities. In many areas across southern and eastern Africa, human smuggling is not seen as immoral or a particularly criminal activity. It is perceived as a legitimate livelihood, a services industry. And the local legitimacy of these smuggling networks has posed a significant obstacle to counter-smuggling efforts to date and to the narrative of the criminalization of smuggling offences. However, infectious diseases create a fear of strangers, COVID even more so, given that it can be asymptomatic. And we're starting to track reactions in some areas where there's an increased hostility to human smuggling activities. So we may be seeing a shift in long-standing perceptions of human smuggling, which is now perceived to threaten the community. And smugglers themselves in some areas have stopped applying their services for fear of contagion to themselves or the communities from which they come. I'll briefly outline a case study which illustrates a number of these dynamics. And this is concerning the impact of COVID on the human smuggling route to Mayotte, which is an island in the Indian Ocean, geographically part of the same archipelago as the Comores, and which is legally part of France, which also makes it a smuggling destination country. So, as many countries, in response to the beginning of the pandemic, Mayotte's surveillance and Coast Guard operations increased across late March, although more recently some analysts are noticing a slight relaxation. The flow of migrants to the Comores, which is then the main, setting off point onwards to Mayotte, slowed because it was much more difficult to get there in the first place. As a knock-on effect, arrivals in Mayotte were significantly lowered. Some estimates by local analysts suggest that by as much as going from 4 boats per day, each carrying 20 people prior to the pandemic, to 4 boats per week. And we have seen a wave of Comoran migrants returning home, with many using smugglers to do so. It's key to note that here, as with the rest of the region, those migrants that have travelled very far afield, many don't have the option to go home. And finally, turning back to the Mayotte example, many smugglers have been less willing to work because of fears of contagion, and in particular, a perception that Mayotte has been worse hit than the Comores by the COVID pandemic, although this may just be because of greater transparency in figures. So looking ahead, in the short term, COVID has posed a significant obstacle to the business operation of many human smugglers in Southern Eastern Africa. And overall, we are seeing a lull in human smuggling activity. However, we would like to emphasize that we believe that this is very much temporary. The demand for movement has not gone away. If anything, given the widespread devastation of livelihoods that COVID is expected to leave in its wake, the demand for movement will increase. And it's important to remember that it is not just economic migrants that use human smugglers. Refugees are singularly dependent on human smugglers as well. So the concept of the demand for movement as elastic in many contexts is misplaced, and this demand will continue even through the pandemic. Now, economic hardship in many countries of origin or transit is likely to trigger a mass exodus once the current border controls are relaxed. And as we have seen with the Mayotte example, it is simply not feasible, as Simon noted, for borders to remain completely closed for a very long period of time. Once these ease, we are likely to see an enhanced demand to leave the country, and yet we're seeing growing anti-migrant sentiment and the ongoing securitization of the migration landscape, which means shrinking pathways for legal migration. To bring the equation together, we have greater demand for movement, a greater proportion being forced to move irregularly in increasingly hostile environments to migration, and therefore the services that smugglers provide are going to be more central than ever. And as I highlighted at the beginning, where smugglers are forced to operate more clandestinely, typically we see protection risks for migrants increase. Therefore, although we are seeing currently a lull in the post-pandemic landscape, there's a significant risk that we're moving towards a more powerful, a more lucrative, and more dangerous human smuggling industry in the region. And unfortunately, as always, migrants will be the ones that suffer the most. Thank you.
Thank you, Simone. Thank you, Lucia. Sorry about that. Thank you, Lucia. That was a very, very interesting presentation to listen to. We have heard about the impact of COVID-19 on human smuggling, the disruption of routes, changes in the smuggling routes, air to land, bypassing authorities and vigilante groups. So all these are very, very intriguing examples which have gone from Southern Africa to Red Sea and to the Indian Ocean, Mayotte Island. These are very, very intriguing examples, and I believe that this research will constitute a very interesting reading. It is also interesting to hear that migrants are even being abandoned by the criminals. So it is also interesting to hear what is likely to happen after the pandemic. We have received a lot of questions, a lot of comments via email, and I would like to thank a few people for their questions. Miriam Manak, we have received your question, and I can also see your hand. Dikosman, I can also see your hand, but please be patient. We are going to give you a chance to speak after two more speakers have spoken. Tom Carter, I can also see your hand. Thank you, those who have sent their questions through. We will be reading them after this, after we have heard from John Patrick. John Patrick is a criminal intelligence analyst for East Africa, based at the Interpol headquarters. He is working from Nairobi, and John, we would like to really hear from your presentation how criminal actors in various countries in the region cashed in on COVID-19, because this has been in the media and we have heard a lot about it. The second thing is what pharmaceutical products deemed to be useful in the combating the pandemic have been targeted by the criminal actors, and what is the size of the seizures of the affected pharmaceutical products, and how do these fake pharmaceuticals reach the region? Those are some of the questions. I'm sure there will be more that will be coming, but for now, allow me to give the floor to John Patrick Broom.
Thank you, Dale. Good afternoon, ladies and gentlemen. As mentioned there in the brief introduction, my name is John Patrick, and I am a criminal intelligence analyst with an ACT based in Nairobi and have responsibility for covering the East of Africa. I'm additionally a former customs intelligence officer with experience working in relation to different commodities. Today I'm going to discuss, as mentioned there, the post-COVID developments on illicit medications in East Africa. I'm going to look at what work is being done and what we are seeing in regards to some of the changes to this form of criminality. Okay, so initially, by way of an introduction, what I want to say is that whilst illicit medications have not been historically the most significant criminal commodity, we are seeing changes to that trend. Change is happening now, and it's very important to understand this during this unprecedented COVID-19 impact on East Africa. And ACT are seeking to understand these changes, particularly regards criminal methodologies that develop and how criminals are looking to exploit the desperation of people within societies to have some form of control and some means to try to address the dangers posed by this pandemic. So first of all, what I'd like to do is mention that we have a pending report on this topic for those that are interested. So there'll be a public report available in the last quarter of the year. Work is ongoing on this. However, regards initial insight, I'd like to provide what we believe may be a bottom line up front. So we believe at the moment, it appears that there will be an increase in levels of addiction for certain medications and loss of life from inefficient medications and healthcare shortages, all enabled by increased organised criminal activity in this particular field. Okay, so as has been mentioned, an ACT have responsibility for enhancing Africa's response to transnational organised crime, and we do this by maintaining a presence within Africa and having a professional analytical capability on the ground. That has indicated a number of factors which are contributing towards changes concerning the illicit medications market within Eastern Africa. So what we are particularly seeing is an increase in prescription medication addiction, an increase in seizures of illicit medications, and an increase in social levels of concern regarding healthcare shortages. When we progress with this work and we look to produce the publicly available report in the last quarter of the year, what we will look to do is take stock of the informal supply of medications, take stock of supply of counterfeit medications, and examine more in-depth criminal typologies around the production of these medications if they're counterfeit, acquisition of medications for informal supply, and trafficking methodologies. So firstly, I want to clarify what it is exactly I mean when I talk about illicit medications. So on one side, we have counterfeit medications, and then parallel to that, we have black market medications. So I'm going to talk about counterfeits briefly first. There's complex international definitions of what constitutes counterfeit medications. However, a number of key factors relate to the production and the inefficiency of these medications in dealing with the conditions that they're aimed at trying to address. Some examples include anti-malarial drugs, cancer drugs, antibiotics, fertility drugs, and diabetic medication. Some of the issues around the counterfeit supply of such medications are fairly obvious. Many of these drugs serve to to treat or to tackle chronic conditions that are a threat to life. Insufficient supply or insufficient levels of the active ingredient within those drugs can, of course, lead to death. Even if the condition and the original medication is not aimed at a life-shortening disease, there is a risk from what we're seeing with some counterfeit medications that they contain toxic substances. There have been examples of glass particles identified within medications, in addition to insufficient levels of active ingredients, or in one case as well, trace elements of pesticides identified as well. So sort of a duality of threat posed by these, that they're insufficient in dealing with the original condition, or that they may actually contain some harmful substances. So moving on to black market medications. Here we're talking more about legitimate medications that fail to comply with regulatory requirements. This might include undeclared medications or sold via unlicensed means. Some of the examples of things that we're seeing include opioids, STD drugs, allergy drugs, contraceptive drugs, and hypertension drugs. Again, fairly significant medications, and some of the issues are obvious. Impact on health care systems are a key component of some of the risk factors in East Africa. And here we talk specifically about the diversion of medications away from legitimate supply chains into illegitimate mid-markets. So criminals are able to, usually through corruption, identify options to gain access to this medication and then sell it without the necessary regulatory controls. And that regulatory control is the second big issue regards these black market medications. When you lose regulation, you also lose the professional guidance that has to come with the administration of such medications. We've talked about opioids and other drugs here that are potentially highly addictive. And within healthcare systems, there exist these regulations in order to maintain a supply and a treatment plan which is consistent with avoiding the individual becoming addicted to these drugs, or indeed self-administering these medications through a means which would be harmful to their health through overdose, etc. So those are some of the main issues and the two types of illicit medications we're looking at. Regards criminal methodologies that we're seeing in the initial stages, I want to talk briefly about victimization and what factors are at play to facilitate the dependency of people on illicit medications in East Africa. What makes people vulnerable to the exploitation of criminals involved in this area? So firstly, indications are that limited access to healthcare systems in the region is a primary driving factor. So when we look at some of the informal settlements and individuals dependent on the day economy, there are socioeconomic factors that prevent individuals from accessing legitimate healthcare. And that in turn puts them into a vulnerable position and liable to exploitation by criminal groups involved in the supply of illicit medication. Specifically around methods, counterfeit medications, there seems to be a large degree of these sold online, and this is to maximize the benefit to the criminal through the anonymity which is provided through that methodology. These are also internationally sourced. Not many counterfeit medications are produced within Africa itself. The primary state where these are sourced is China, and obviously the importation of any illicit commodity across half of the planet has logistical challenges that my previous colleagues have spoken about regards of the commodities. And to a certain degree requires a sophisticated criminal organized approach to adapt to these methodologies. Organized criminals are also linked with, to that ends, with logistical companies within Eastern Africa to be able to facilitate the movement of these commodities, particularly into Eastern Africa via Kenya, due to the logistical links through maritime links to Asia. So regards methods and concerning the black market medications, here the primary driving factor appears to be corruption. So the utilization of often legitimate pharmaceutical businesses that perhaps are struggling in terms of their business and identify an opportunity to work with criminal organizations, or are indeed approached and compromised by criminal organizations in order to gain access to legitimate medications and then sell them on the black market. So corruption is effectively enabling access to otherwise regulated and legitimately controlled medications, with the obvious risks we've already spoken about. Additionally here, one thing I want to mention is the supply of medications into regional healthcare systems and specifically to the hospitals. There are examples of criminals being able to compromise the supply chain to hospitals, with the obvious implications being that during this pandemic period, when the various East African societies are relying on hospital treatment, where we are seeing situations which could progress to the point that hospitals are receiving insufficient supplies of certain medications required to produce effective treatment plans around COVID. We also, as mentioned, lose the regulatory safeguards that are in place to avoid addiction in relation to this, and there would be no inclination by criminal organizations to ensure that victims comply with otherwise sound medical regulatory advice. So some of the impacts at this time of these illicit medications. So counterfeit medications, the World Health Organization estimates 100,000 deaths in Africa each year. Based on the bottom line already mentioned in this, there is an expectation that this will be significantly higher over the COVID-19 period. Criminal profits of up to $200,000 per year. A hindrance of legitimate attempts to tackle the COVID-19 pandemic. This specifically relates to the point I've covered around healthcare system supplies. And there of course is impacts on other healthcare issues, HIV being the big one in the region. What impact illegitimate or fake counterfeit medications may have on parallel treatment plans cannot be assessed. So when we look at the black market supply around the impact, there is it weakens the struggling healthcare systems, as already mentioned. It increases levels of addictions and poses risks to combined treatment plans with other forms of medication. COVID is particularly, due to the prominence of it, seeing an increase in the form of criminal profits, which in itself is a facilitation factor to appeal to new generations of criminals to get involved in this particular market. And across the board, we appear to be seeing an increase in levels of corruption and the potential collapse of healthcare systems based on the opportunity to exploit legitimate healthcare supply chains. So what I want to do is just walk around a little conceptual loop from where we started with the bottom line. So some of the risk factors in the region concerning the ever increasing numbers of COVID cases within Eastern Africa include the presence of large international communities in Nairobi, Kampala, Dar es Salaam, some of the porous border issues and the continuous movement of people we've seen. Weak and under-resourced healthcare systems have been mentioned a number of times here. We've also seen an acceptance to a certain degree of misinformation regards COVID-19. This can involve some of the potential treatment options. I'm sure the audience is aware of some of the famous promotions we've seen in international news around treatment plans, which have subsequently proven to be ineffective. These are spreading rapidly around the region as a result of social media, and there is a tendency to accept some of these as legitimate. There are also difficulties in applying social controls to limit the virus due to, as mentioned, the formal settlements and day economy. So this appears to be increasing demand for therapeutics and medications identified by media sources and other sources. And subsequently, we're seeing an expansion of organised criminal networks involved in illicit medication supply to meet that increased demand, which in itself will move from a position, as mentioned in the opening remarks, regards illicit medications not representing a traditionally large-scale illegal commodity to a situation where it increases and we see an increased level of addiction and loss of life from ineffective medications and healthcare shortages, as mentioned at the start. Thank you very much.
Thank you, John Patrick. Very intriguing once again, and it is my pleasure to reiterate what you have said, that we should look out for the public report of what you have presented on the ENACT website a few weeks down the line. So those who have really followed that with interest, please look out for that report when you visit our website. And thank you very much for drawing our attention to the importance of hospitals and why criminal actors would target the drug market at the pharmaceutical industry. And you have highlighted a number of issues, factors that facilitate it, like corruption and compromising supply chains, and many other impacts that you have had. I'm going to give the floor to the last speaker. I can see another hand, Dumia, I can see your hand. Pamboro, thank you very much for the question about sharing the presentations. Of course, we are open to sharing with the public as much as possible so that you know what's happening. We can communicate after this on how best to do that. For now, Martin will be the next speaker, and he will be talking about how the COVID-19 has had an impact on terrorism and violent extremism in East Africa. So Martin, to what extent have these measures, the COVID-19 measures, affected extremist groups in the region? Have we observed an increase in the activities? What are the criminality opportunities? Government, we would like to request you to please mute your microphones. So what are the criminality opportunities that that these restrictions on movement imposed on governments in the region to curb the spread of COVID-19, what has it presented in terms of opportunities and challenges to the violent extremism groups, especially Al-Shabaab, because that's the one that we know in the region. Martin, you have the floor.
Thank you very much, Chair. Once again, my name is Martin Iwi. I'm the Regional Coordinator FINACT based in Pretoria. I know I'm standing between you and the discussion, which we are really looking forward to. So I do not intend to delay you much for that, but rather to highlight a few points in terms of the opportunities and difficulties that terrorist and violent extremist organizations have faced or are facing during this period of COVID-19. Indeed, the general expectation, or if you wish, the common sense view has been that the pandemic provides an opportunity for terrorist and violent extremist groups to gain momentum. This is based on the assumption that faced with COVID-19, African states will redirect focus and resources towards combating the pandemic, leaving a vacuum that violent extremist groups would be more happy to fill. A growing number of reports suggest indeed that terrorist groups are benefiting from COVID-19 and that the pandemic has enabled terror groups to increase attacks. an article published by the Institut de des Relations Internationales et Stratégiques yesterday asked its readers whether the prevention of violent extremism and combating COVID-19 are contradictory or interconnected. This again is to further highlight the perceived tension or conflict between the two, the fact that states cannot at the same time combat terrorism while at the same time combating COVID-19. East Africa indeed has a number of active terrorist and violent extremist groups, such as Al-Shabaab, the leading terror organization, which has been operating since 2006. But you also have the Islamic State in Somalia, the Allied Democratic Forces, the ADF, the Lord's Resistance Army, the LRA, the Mungiki, the Ali Dere, and many other groups in the region. For the most part, these groups have continued business as usual without having to make specific operational and structural adjustment to adapt to the COVID-19 era. Let me also note upfront that all of them heeded to the UN Secretary General's call for immediate ceasefire in order to focus effort on combating COVID-19. In order to evaluate the impact of COVID-19 on terrorism and violent extremism, I want to take a few quick minutes to examine its implication on four main areas. The first one is terrorist messaging. We have seen terrorists react to the COVID-19. Not all terrorists or violent extremist groups have made declarations or statements on COVID-19. But the Inter Center, which is an organization that keeps data on terrorism, indicates that by 15 May this year, terrorist and rebel groups had issued about 412 written statements, photos, graphics, publications, videos, and audio messages on COVID-19. In Africa, messaging has been limited to the Islamic State and Al-Qaeda affiliate, including, of course, Al-Shabaab, Boko Haram, the Al-Qaeda group for support of Islam and Muslims, JNIM. The messages issued so far have indicated inconsistencies in the way terrorists perceive COVID-19. It is quite evident that different violent extremist groups see the virus and the opportunities it presents differently. Al-Shabaab, for example, has issued more than 40 COVID-19 related messages, making it the leader in Africa in terms of those groups that have issued messages. Throughout this messaging, through these messages, terrorist and violent extremist groups have attempted to offer their own alternative narratives about the pandemic. Al-Shabaab, for example, has largely seen the virus as a Western propaganda and blaming non-Muslims and African Union forces in Somalia for spreading the virus, or what they describe as the Crusaders forces who have invaded the country and disbelieving countries that support them. It has also offered a religious view that described the pandemic as punishment visited by Allah upon disbelievers and call on Somalis to rejoice of this act of God, by bringing the coronavirus, which they believe will decimate the Western world. The second area that I want to quickly look at the impact of COVID-19 is in the field of attacks, the area of attacks. Again, as I said earlier on, that the belief has been that attacks will certainly increase because African states will be more focused on combating COVID-19. Here, I want to look at the attacks during this period of COVID-19. Globally, if we look at the trend, it is that it seems that there is a general decline in terrorist attacks worldwide. But this has been the trend for a couple of years now, if we read the findings of the Global Terrorism Index. But some terrorist hotspots in Africa have seen an increase in attacks by specific groups, which have raised alarm that this increase is due to the pandemic. In the Sahel, for example, the JNIM and the Islamic State for the Greater Sahara have increased attacks in Burkina Faso and Mali. More than 1,200 people have died in the Lake Chad Basin, which include Cameroon, Chad, Niger, and Nigeria. More than 150 attacks, actually. So 1,200 people have been killed by Boko Haram in over 150 attacks. That's enormous, that's huge. And it's only comparable to the period that the group was at its height in 2014. We have also witnessed a dramatic increase in attacks and frequency of attacks by Islamists in northern Mozambique. I think all of us have been overwhelmed by the different attacks that we've seen and the evolution of the Islamists in that country, especially the alliance it has made with the Islamic State. The Islamic State is also making a return to Sinai in Egypt, which means that they are taking opportunity of the fact that the Egyptian government is more focused on combating the virus in order to make it way back to Sinai after they've been driven out in that region for several months now. We have seen also the, or let me just quote here, the armed conflicts location and event data indices, which they provide complex indices on violence, political violence, and terrorism. Their data show that in April alone, 1,167 terrorist victims occurred in Africa. In April alone, showing 59% increase more than the previous year. During that month, terrorists and violent extremist groups kill more people than COVID-19. To zoom in East Africa, we have also seen increase in attacks. ACLED records confirm that Al-Shabaab has been carrying out daily attacks, particularly in its stronghold regions in Lower and Middle Shabelle, Junale, Banadir, and Lower Juba. The Allied Democratic Forces have also increased attacks between February and May this year. The group has concentrated its attacks in North Kivu of the DRC, the Democratic Republic of Congo, particularly in the Walese Vonkutu localities. Some estimates indicate that the group has killed nearly 700 people. This is huge because the Allied Democratic Forces are not known to carry out these huge attacks, though the group is known for its use of criminality, organized crime to survive. Furthermore, a significant number of attacks have been attributed to the Islamic State Central Africa province, which has formed alliance again with the ADF. The key question that remains relates to whether these attacks or the increase in attacks is due to COVID-19. No studies have been conducted to provide the empirical evidence that indeed it is because of the opportunity that COVID-19 presented that these groups were able to carry out attacks. This is because terrorism by nature follows what I call a zigzag curve, meaning that there are periods of low attacks and periods of high attacks. So if this is a period of high attacks, can we then conclude that it is because of COVID-19? There is no concrete evidence to support that. The third area I quickly want to look at is the terrorism survival strategies to see whether COVID-19 has actually impacted on the way terrorists try to survive. Terrorists are known to use organized crime for recruitment and for resource mobilization. In East Africa, Al-Shabaab, the ADF, the law-resistant army are known for their use of wildlife crime, including cattle rustling and livestock theft, illicit trade in charcoal and drugs, timber, and illegal mining, and many others that they are known to use. Now, from the three previous presentations that we have had, the trends in many of these issues have been affected in terms of the organized crime. Because of the lockdown, these groups have not been able to move around. So the lockdown and the restricted movement, the closures of borders, as we have seen, have significantly reduced organized crime activities. Now, how have terrorists been able to adapt to this new situation? We've seen in the case of Al-Shabaab, for example, turning towards zakat. And some have actually attributed the increase in attacks to be a response to this closure, because terrorists still need to mobilize the means, they still need to mobilize money and resources for them to survive. And therefore, they can only do so by attacking communities where they will loot and they will do all sorts of things to carry away, stuff that they need for their survival. The fourth area I want to look at is in terms of health, because I think earlier on the prediction or the thinking was also that probably if COVID-19 were to affect terrorist group, it could decimate the group because they won't have the adequate or appropriate healthcare system for them to treat themselves. But again, here we don't have any evidence, and we know that terrorist groups have kept their health status as a top secret. So we don't even have any data to show that indeed in terrorist camps they have been infection. And therefore we don't know how the COVID-19 itself has directly affected these groups. In conclusion, I want to state that with the exception of the messaging that we've seen earlier on, it has been very difficult to demonstrate the links between terrorism and and COVID-19. Some of the messaging that we saw earlier on is that terrorists have actually tried to exploit COVID-19. For example, they have called for a militant to take advantage of the virus and to weaponize the virus, to use it as a biological weapon through collecting the specimen and contaminating millions of people. That again hasn't happened, but we have heard statements about it. And then also violent extremist groups have tried to use the pandemic to spread fear and for recruitment through their messaging. Al-Shabaab, for example, use it to say, the Western world and the infidels, the disbelievers, this is a curse for them. It is time for people now to repent and to join them. This is not just a messaging from Al-Shabaab. We've seen that with many of the Islamist groups, ISIS, Al-Qaeda, Boko Haram, and many others. At this stage, therefore, there is no conclusive evidence on the impact of the pandemic on terrorist methods or modus operandi. So far, the COVID-19 pandemic seems to prove the high adaptability and resilience of violent extremist groups. More evidence, some of the reports say that more evidence, however, suggests that states are those who have really exploited COVID-19 to apply excessive and unfettered use of force against terrorist groups and other opposition to state power. Thank you very much, Chair.
Thank you, Martin. We have very little time left. I can see that there are people who have sent in their questions. I am trusting that the speakers have noted down the questions that were asked of them. I'm going to just go through some of them very quickly, the ones that were asked to everyone. Is there room for non-state actors in preventing transnational criminal networks. That is from Mustafa Ahmad, thank you very much. Dimitrova, what financial means of payments do organized crime criminal groups use to fund their activities? What are the current purity levels of drugs? That is to Simone. In the streets, are the current levels of drug supply disrupted by COVID-19? That is to Simone. Has the insurgency in northern Mozambique impacted national enforcement and cooperation with the European and the East Asian countries? I think that was touched on by Lucia, but Simone can also maybe look at that question because it was directed to her. How do gangs and organized crime groups open up new markets while co-opting local communities? You have drug inflows from Europe into Africa. How has that been affected? That is from Miriam Manak. Evan Grant was the one who asked the question on northern Mozambique. Fiona Napier asked the question about how the organized crime groups open up new markets. Then Kinton Walker, do you think local Cape gangs transported drugs during their truce? And then Eric Kane, I think part of your question has been answered by Martin. Any research on DRC and any specific publication? Your question was also answered by John Patrick. So I'll give based on those questions, and I can see that many of the people who have raised their hands have also asked questions. But given that I have only 2 minutes left, I'll give the chance to Simone and then all the speakers very quickly in 30 seconds, just tell us what you would say in response to those questions that have been asked. Fumio Ito, what extent have online platforms been used to market illicit products? Those are the questions that I have and that have been asked. Does terrorism in Mozambique have anything to do with the gas reserves? That is Fernando Cardoso. Ladies and gentlemen, because of time constraints, you will forgive me for not giving you a chance to speak, but I have all the questions. I believe I've covered all of them. Let me give the chance to the speakers to respond very quickly, and then we will wrap up. If I have 1 more minute, I'll probably give it to Ndumia and Enehi Prince, who have not sent us any questions through. Let's start with Simone, very quickly.
Thanks, Deo. I'm not going to go through the questions one by one and in great detail, but I will say that you can find more on many of these questions in recent publications by the GI. Specifically on Northern Mozambique, last month we published a special edition of the Risk Bulletin that had 3 really good articles looking at the conflict from different angles, including what links it does, or as the case may be, does not have with the illicit economy and the smuggling networks. Another one looking at governance issues, which touch on, I think, the degree to which the government's handling of the issue and the local grievances are tied to gas. We have podcasts that are coming out soon, or has already come out, I'm not quite sure, on the wildlife trade and COVID, and much more on drugs and other issues. So particularly also on, sorry, I remember now, the question around local communities and the gang truce in Cape Town. And there is a short photo illustrated, very nice piece on that on the website. So I would really encourage you to check out the resources that are available there, free to download. And if anyone would like to discuss the research that's in the ENACT reports that I've been involved in, you're very welcome to contact me. I'm always interested to hear about the research that other people are doing. So thank you very much for listening.
Thank you, Simone. Thank you, Simone. The next would be I doubt that there was a question directed to her, but Lucia, please tell us something before we move to John Patrick, who has 2 or 3 questions.
Of course, I'll be very brief, and I'll address the question regarding the role of non-state actors. And yes, there is certainly a role for kind of community initiatives in countering transnational organised crime. We at the Global Initiative have been supporting community resilience movements as part of the Resilience Fund. So if you're interested in learning a bit more about how non-state actors can play a role in this, then please take a look at the Resilience Fund materials. And we're also publishing an upcoming report looking at taking a gendered view on resilience and community resilience, including during the time of COVID. Thank you very much all for listening.
Thank you, Lucia. The next one will be John Patrick, very quickly. Just address the questions you have, that have been asked of you very, very quickly, and then we'll move to Martin, and then we'll wrap up.
Thank you very much, Dale. So I'm going to focus specifically on the question from Fumio. Thank you for the question. So you highlight a very important issue, and social media and other online business platforms do play a primary role in the supply of black market medications and counterfeit medications as well. This is likely to continue and indeed expand, and any attempts to address this illicit commodity trade by law enforcement would need to take active measures and address that opportunity for criminals due to the level of anonymity that it provides. Thank you very much. I'll hand back over. Patrick,
there is a very interesting question from Peter Mabuka. What measures have you put in place? ENACT is an institution of research, and we make policy recommendations, and those recommendations, we do share them with the law enforcement organizations and also with the policymakers. So it is upon the policymakers to accept or use our recommendations. Based on the questions that have been asked, I will give the chance to Martin to say the last word before we wrap up.
Thank you, Chair. I think there was really just one question that relates to me, and it was really about the violent extremism in Mozambique and its links with the natural gas or the natural resources. Current studies suggest that we at the ISS are planning to undertake an empirical study, which hopefully will be able to prove that this is true. But what we know now is that there is a link between the two, and that it is actually the natural resources that have either inflamed or they triggered the violent extremism. So thanks, Chair.
Thank you, Patricia Nangami. We have seen your question as the lockdown affected illicit flows in accelerating organized crime. Yes, that is something that you could see on the various research, the research reports that we have on our website. You're welcome to visit our website, ENACT, and also visit the Global Initiative website, where you can read more about that. So, ladies and gentlemen, I am really sorry that I couldn't keep my promise. Sometimes time does dictates how we do our things, and so for that reason, I would like to just wrap up by saying that I would like to thank all of you for the busy schedule, for taking time off your busy schedules to attend today's webinar. And it was on impact of COVID-19 on transnational organized crime in East Africa. We had a lot of information, very, very rich information. You would forgive us for not giving you the chance to speak, but at least I believe and I am convinced that you had a lot of information that will enrich your knowledge. I would like to once again thank the European Union for its support, and I thank Mr. Vincent Dubois, the head of macroeconomics and governance section, for his opening remarks. I would like to thank project partners Interpol, GI, and ISS that worked hard to achieve a quality webinar through phenomenal presentations, and you would agree with me, very professional efforts during the preparations. I would also like to thank for his efforts during the preparations, the EU delegation team, and led by Jean-Pierre Bardoul. And I would also like to thank the ISS communications team that has enabled us to communicate today, and the ISS ENACT project team that were very, very instrumental in organizing this, led by Eric Pelser. The ENACT project will continue to hold webinars on various forms of transnational organized crime in order to promote policy dialogue throughout Africa. We will promptly bring to your attention our future events. To all the 179 of you who participated in this event, I thank you very much, and I welcome you to our future webinars, but most importantly, to our websites, so that you can read more about what we do and the policy recommendations that we are making to the policymakers, the law enforcement organizations in Africa, so that we can make a difference. Thank you very much, ladies and gentlemen. That marks the end of our webinar.